Hello and welcome to part 2 of the 4-part training series, Training for Mental Health Workers in India in Trauma-Informed Interventions and Care, presented in collaboration with Trauma Dissociation Study Group India. My name is Naomi Halpern, and before I begin, I'd like to acknowledge the traditional owners and custodians of the land from where I'm broadcasting this training, the Gada Banud of the Eastern Maar Nation, and to pay my respect to elders past, present and emerging. Now, in part 1 of this training series, we explored trauma responses and how to respond to anxiety and fear. So if you haven't watched part 1, it would be helpful to do so, as the concepts that we covered in the first training will also, of course, apply to this training about grief and loss. But I won't be repeating things that I said in the first training. Now, Aditi forwarded your survey responses about what you're looking for in this training, and I'd like to thank her very much for her input and support in preparing this training. We've discussed the content, and I've incorporated as much as possible from the feedback that you've given about what you're looking for. What is strongly coming through in those survey responses is the enormity and the devastating impacts of this pandemic, and that as mental health professionals, you're experiencing a heightened demand for your services and a level of ongoing distress that's really unprecedented. And of course, also for everybody's safety, you're needing to adapt your work and your skills through utilising telephone and Zoom consults. That is going to be a new format for working with clients for many therapists. And so these factors combined are contributing to even very experienced clinicians feeling de-skilled and also understandably very overwhelmed, particularly as this is not just a crisis that is happening to people out there, it's also happening to you as well. And at the same time as you're working with clients and trying to support clients, you're also doing your best to manage your own fears, your own concerns and worries. And I'm very mindful as we begin this training that some of you may have tragically also lost family members, friends, colleagues, and others in your community. So firstly, I would like to really acknowledge you all and your commitment to your clients, and to normalise your experience of feeling overwhelmed. And I want to take this opportunity to remind you of something that I know that you already know, but it's easy to forget or to push aside when we are feeling overwhelmed and we've got so many demands being placed on us, that there are no quick fixes to assist people who are experiencing grief and loss and going through different issues and aspects of the whole trauma of this pandemic. And normal grief and loss, as you know, really takes time to heal. And with traumatic grief and loss, which is what a lot of the people that you are working with currently will be experiencing, takes even longer. And of course, once the pandemic has passed, and eventually it will pass, we don't know how long that will take. And of course, that is one of the ongoing stresses and fears that everybody is facing, is like, there is no endpoint in sight that we can say, oh, well, at this date, things will be better, things will begin to return to normal. It's all unknown at the moment. But once the real severity of the pandemic has passed and things begin to go back to some sense of normality, in many ways, this is when the real journey of recovery as individuals, as families, as communities and a nation will be able to begin. And so I would like to encourage you to try to take some of the pressure off yourselves. Now, as mental health workers, we are an important part of the pandemic response, but we are only a part of that process of healing and recovery. We can't take on board all aspects of what people are experiencing or take on responsibility to save or fix things. So I'd like to encourage you as you listen to this training to try and be mindful of your own feelings and responses as we go through the material, and to just slow yourselves down, to feel your feet on the ground and to focus on your own breathing, to just keep yourselves calm and centered as we explore this really difficult subject of grief and loss. So we're going to be covering a wide range of factors around grief and loss. First of all, looking at the differences between normal grief and loss and what is traumatic grief, and also the different types of losses that people will be experiencing that are specific to this pandemic, as well as looking what does it mean when a whole community or nation is experiencing grief and loss. We'll look at some of the specific faces that we will see with clients who are experiencing grief and loss, specifically looking at issues around shame and guilt around people's losses, as well as the locus of control shift, how people try and assign responsibility or blame for things that are happening. And that includes then really understanding some of the transference that our clients will be experiencing, the thoughts, the feelings, and the ideas that they may project onto us as therapists, which of course transference, as we know, it's grist for the mill, it's part and parcel of therapy with clients. And also we know that, if a client isn't, if there isn't some transference in the therapeutic relationship, then the client may not actually be really fully engaged in the process, because the transference is part of us, working with those issues that are troubling our client, that might be keeping them stuck in particular ideas, beliefs, and ways of being. And then we'll look at post-traumatic countertransference, what we're bringing into our work with our clients, not only all the normal stuff that we as therapists will have in our own histories, but of course our own concerns and fears and anxieties related to the pandemic as well. We're going to look at empathy and compassion, the difference between the two, and how we need to try and balance those two things out. And then look at some specifics around supporting adults and children and working with groups, as well as really, I guess, a summary of looking at what it means in terms of the long-term healing of nations, of communities, and India as a nation as a whole. So let's begin this journey now with looking at the difference between normal grief versus traumatic grief. We know, I'm sure, that all of us already in our lives will have experienced some kind of grief. And of course, grief and loss covers many different things. It's not only about losing a loved one through death, but it can be through divorce or separation. There can be grief associated to a change in our physical health and needing to adjust to a new reality, how we were before we developed a particular condition or had a particular injury that is now impacting our lives going forward. It might be as a result of financial losses or job losses. I mean, there are loss of fertility. I mean, there are so many different types of loss that are a normal part of life. And so, of course, we know from the different losses that we will have already experienced in our life that, some of those losses can take a considerable amount of time to work through, to process that. Working with our grief is not sort of like linear, sort of like go through this stage and that stage, and then all of a sudden, there's light at the end of the tunnel, and we are through whatever that particular loss might be. With some experiences of loss, it's really something that we carry within us for the rest of our lives. We will always miss and grieve to some degree that particular person or part of our life, but we find a way to live with that, to have that grief, I guess, sort of like more alongside us and not completely dominating everything that we feel or how we move through life from a day-to-day perspective. When we're talking about traumatic grief, which of course is what many people in India are experiencing right now, the intensity of that grief is going to be really magnified for people, and the intrusiveness of the distressing symptoms are going to be ongoing and really interfere with people's ability to function in their day-to-day life, to go about the things that they would ordinarily do, and really may have significant impacts on diminishing their functioning. Now, we would also expect in normal circumstances, when someone has a major loss in their life of a loved one, that it would interfere with people's day-to-day life for a period of time. But we also see in those less traumatic circumstances that people will go through all those normal stages of grief that we understand, which we'll be looking at shortly. But they are able to, to get back to some degree of functioning, even if they don't feel fully present, even if they feel like they're going through the motions of taking care of kids or work or doing the things that they have to do, that they're able to do, they are able to get back to that level of functioning. But with traumatic grief, we see people really quite severely impaired over a long period of time. And of course, we know that grief and loss are universal. It's an inevitable part of life. I think probably some of my earliest memories of grief and loss were as a child of losing beloved pets, a cat or a rabbit or the family dog. So these are experiences that we are often exposed to from a very young age. And of course, there can be other more significant, no, it's wrong, I shouldn't say more significant, because our pets are very significant, but I would say losses that can have more far-reaching impacts when people are young too, like health crisis or the loss of a parent. And of course, we also know that grief is intensely personal. We'll be talking about that a little further into the training when we look at supporting adults, and particularly in couples where people may be, may grieve differently from each other, and some of the stresses that can place on relationships when people grieve differently and they aren't able to find a way to support each other and connect with each other. But what we do know is that grief is not something that we can just say, oh, we'll go through this phase, that phase, and the next phase, and then, as I mentioned before, we can sort of like tie it up in a bow and stow it somewhere over there, and it's no longer part of our life. Because when we've lost something, life is never the same. In time, the pain does lessen with grief. Memories of who or what it is that we have lost, rather than kind of creating a wave of emotion and you know, of tears or despair, can instead bring up memories of you know, of joy and, you know, and laughter, as well as alongside those feelings of sadness and emptiness. But when people come to us and they have experienced a recent loss during this pandemic, feelings like, you know, my life is over, this pain will never leave me, are just very normal. And these are feelings that we want to really embrace in our clients, and our role is to help and facilitate our clients to be able to embrace those feelings as being, you know, normal and understandable, and as much as painful as they are, not to try and just, you know, get rid of them. I want this pain to sort of like just, you know, leave me and go away. And to importantly remember that we cannot and we shouldn't be trying to stop another person's pain or to take it away, because going through that pain is a really important part of the grieving process. And I think for us as mental health workers, when we see people in deep pain, you know, it touches us as well. We'll be talking about that more later on in the training too. It touches us, and we want to do something to, you know, to try and help our clients feel better. I mean, isn't that our job? That's, you know, that's what we do. But we also need to understand that assisting our clients through their grieving process is not about dampening that pain or necessarily shortening the period of time that they experience that pain, but to help and guide them and support them and, you know, metaphorically hold them while they go through it, because the pain is a really important and integral part of that grieving process. And so when we're talking about traumatic grief, we are always, you know, when we're talking about grief, we don't always mean that we're working with trauma, but trauma always means that we are working with grief. And often, you know, I talk to clients about working with trauma is like peeling the layers of an onion. And of course, you know, those of us who, you know, cook, whether we enjoy it or not, when you chop onions, you know that it can really sting your eyes, and there is, you know, that the tears flow. And I talk to clients about grief being, you know, like peeling the layers of an onion, and that we need to let that stinging in our eyes be there, the tears to fall, and to peel away one layer after another layer, because grief is a process and there are many different aspects to loss. It's not just the physical presence of someone, but a whole lot of other things too. Our thoughts about things that, you know, we had planned for our future that will never happen. It's what perhaps has been unresolved from our time together, the conflicts that we didn't get an opportunity to resolve, or to apologize for the things that we may have said or done that were, you know, mean or unfair. It's grieving for what happened or didn't happen. There are so many different layers and complexities, and we just need to let those layers peel away in their own time, not trying to force it or to rush it. There are some things that it's helpful to be mindful of when we are working with people who may be more predisposed to experiencing a traumatic grief reaction. And this, of course, as we talked about in part one, in terms of dealing with anxiety and fear, that people who have a history of childhood abuse or neglect or some other form of trauma are going to be more vulnerable and susceptible to experiencing loss in a very sort of like traumatic way, have greater difficulty being able to embrace their loss and to work through the different levels or layers of the onion. If there's been intergenerational trauma, we know that that is more likely to predispose someone to complicated grief reactions. And of course, if there's community trauma, which the pandemic is absolutely a community trauma, not just for small, localized communities, but for a whole nation. And so we really need to be expecting that there are going to be very large numbers of people who are experiencing traumatic grief during this time. And so we also therefore need to be mindful of what some of the longer term impacts might be around traumatic grief, because the impacts of this pandemic are going to be felt for many years to come, not just this generation, but the generation to follow. This pandemic is going to change the face of the world in many different ways, and so the rolling impacts of it, we're not going to know what all of those might be at this point in time. Of course, we know that there's going to be major losses in terms of family and how families look, and the losses in within family members. We're already very aware of the economic impacts and the long-term economic impacts as nations all around the world try to manage the fallout economically and financially of businesses being closed, of restricted movement and travel. So there are also other losses that we probably haven't thought of or contemplated, and we won't know what these are until they do begin to unfold and show their face. But we do know that there will be relationships that won't survive under the huge stress that people are experiencing now. Every aspect of people's lives have been changed. And obviously for some people there are going to be greater changes than others, but no one has been untouched by this pandemic. Some people obviously, and of course this comes about through inequities in our societies, people who have more resources at their disposal, who may be less impacted in terms financially and may be able to keep themselves and their families safer. But we have all experienced it to some degree or another. And so this is why it's important for us all to think about collective grief and trauma and the impacts on whole communities. And this particular slide can relate to all kinds of traumas that communities might experience, from pandemics to things like to bushfires or other natural disasters, but also to the impacts of colonization and intergenerational trauma that we're very aware of here in Australia with our First Nation peoples, and the long-term impacts that when a community experiences a trauma that can roll on for many years to come. And so it's important to think about some of these things, like substance misuse, like the increased risk of violence against women, people maybe being more prone to self-harming, suicidal ideation and risk-taking behaviour. But we're also seeing the fallout in terms of how communities and nations are feeling towards their governments, both at a national level, but also maybe at state levels as well. We're seeing, crisis in leadership and questioning whether leaders have really had their nation or their particular community's best interests at heart, or whether there have been other factors that have motivated decisions that have been made, how things have been handled. And of course, when communities are feeling very overwhelmed, what they want and need to feel is a collective trust that we can rely on those people who are in authority, who are making the decisions. But what we are finding a lot of the time is really the opposite that is happening, and there is a great deal of mistrust, and some of it, of course, is going to be absolutely justifiable mistrust when we, as things get revealed about, decisions that have been made and what was behind them, and so we don't want, we want to kind of have a balanced perspective to our clients, where we don't dismiss their fears and their anxieties or their anger at the way people have handled the situation, but we also need to be careful of the sort of like contagion aspect of mistrust and paranoia, and people assuming things that that may not actually be the case. But the importance of understanding that this is not only about supporting clients at an individual level or within their immediate families, but to see the wider impacts of this situation. And what we see is whole communities who may be hyper vigilant, who are hyper aroused, who are living with fear. I mean, of course, the whole issue with a virus is we can't see it. We don't know where it is. We don't know whether that person that we're passing in the market or on public transport is perhaps infectious. It's not like an area where there is, where there is flooding or a fire, and we know where that disaster zone is, and so we can take clearer steps and precautions to not be in the path or of something that's danger. With a virus, it can be anywhere at any time, and so of course we see people living in heightened levels of fear. And when that fear becomes overwhelming, and people don't necessarily have the inner resources or agency to support themselves with managing, because there's just too many things that they're trying to navigate all at the same time, we will see people turning to alcohol or to substances, whether they're prescribed medications or illicit drugs, as a way of trying to dampen down their fear and anxiety and manage their stress. And of course, when with this pandemic, where people are not allowed to come together in the ways that communities would ordinarily come together to support each other through difficult times, it's creating greater disconnection and senses of alienation and less ability for people to mourn together, grieve together, and make meaning and integrate their experience. And of course, until this pandemic is more under control, until the nation is at a point where you can more safely begin to open up and come together as communities, these kinds of issues are going to be very, very prevalent and real for a lot of people. And so these are important factors for us to consider working with our clients. So let's look now at supporting adults who are experiencing loss and grief. And of course, as you know, we acknowledged right at the beginning of this training that grief is a universal experience. To be a human being means that we experience grief. And of course, human beings are not the only sentient beings that will experience grief. For those of you who have had, pets, or maybe you've had a cat and a dog or whatever, and one of those has died, you will see that, the pet will also go through grief at the loss of their companion. We know that elephants mourn. They come together in their herd and stand around the deceased elephant for several days, mourning before they actually sort of like move on. So grief is universal, but what also is important to recognize are that people's rituals are culturally mediated. And so how people grieve, what is the norm for people to grieve is going to be different from country to country, but also within nations, different communities, different ethnic groups, different religions will all have their own particular rituals and ways of grieving, of coming together. But no matter what those rituals might be, what we are seeing all over the world is that those rituals that people have ordinarily been able to be part of, that is part of the whole grieving process, have not been able to go ahead because of the need to be physically distant, because resources for funerals, for cremations, for burials have been so overwhelmed. There just hasn't been the capacity or the capability for everybody who has experienced a loss to come together with their loved ones and their wider community to grieve in the same ways as they ordinarily would. And yes, of course, people can get on the phone. They might get on WhatsApp or some other platform and be able to see and speak to the person who's going through a loss. But that's not the same as being able to be together in the same room, to talk, to share, to hold each other, and to remember together. And so everything has been turned up by this pandemic. And then, of course, the other thing that will happen in any situation, not just with a traumatic grief experience, but where there has been any kind of loss, is what happens when you have family members who grieve very differently, because we don't just grieve differently in terms of our ethnicity or our religion or our culture, but as individuals, our own sort of like personality and characteristics will shape the way that we grieve. And so when you have people in the same family who grieve in different ways and who don't perhaps recognize or understand, or don't have the capacity to reach out to each other in the different ways that they grieve, then that can create heightened feelings of alienation and disconnect, because we, rather than seeing people sort of like coming together during their grieving process, we can see them withdrawing more and more within themselves, or that one person might try and pursue the other person to, you know, to talk, to connect. Let's, you know, let's be together. And the more they do the pursuing, we see that other person is distancing themselves further and further. And so that can create greater isolation for people. So one of the, you know, the things that we can do as mental health workers is to talk to people, whether you're working with an individual or you're working with a family, or you know, or a couple, is to talk about how each person in that relationship dynamic is grieving, and what they can do to honor and understand and respect each other's grieving process, and at the same time to try and keep those channels of communication open, so that the person who might quite it not be problematic in terms of it being an unhealthy thing, but who may withdraw more into themselves and be more introspective and process their feelings more internally, that person recognizes that that's okay, you know, for them to do that, but to also try and be mindful of, you know, their other family member who needs to talk more, who needs to cry, who needs to show and express their feelings on the outside. How can they respect each other's needs and come together and move apart, you know, as necessary, and still support each other, even though they're grieving in completely different ways. And of course, then we've got the situation, and I am sure that there are just so many cases where this is occurring, where parents or caregivers, whether they are grandparents or extended family members, are grieving for some loss of a, you know, a partner or some significant person in their life, and they are feeling so overwhelmed and distraught that they're not able to support their children, not supporting their children just in terms of like basic care needs, but also perhaps not being able to recognise the children's grief and loss, and being able to support the children with, you know, with what they're feeling and what they may need in terms of help and support. And you know, it's interesting because I think that that probably human beings, and you know, this is a massive generalization, and I'm sure it's not going to be true universally, but I think that a lot of cultures have a great difficulty in being able to grieve in ways that really help and support and bring people together. It's like, you know, it's like death and dying can still be a taboo subject. It's too upsetting, it's too distressing to think of the mortality of a loved one, or our own mortality for that matter, and to talk about you know, how we're feeling and what we're experiencing. I was very sadly a few years ago, a very close friend of mine, over 30 years or so, died. He had cancer, and so we knew his death was imminent, and I felt so lucky and privileged that we were able to talk to each other about what he was feeling around coming towards the end of his life, and that I was able to tell him how I felt about losing him. And so, you know, in a lot of ways that really helped us both with what was, you know, going to be a final parting, and I felt very privileged to be there right at the end. But those experiences of being able to talk to people about what we're experiencing, what our fears, what our hopes, what our our grief is before the event, or going through an event, I think is probably few and far between. That people try to, let's not talk about it. It's like if we don't look that way, then maybe we're not going to be impacted. But of course, at some point, we all will be. And so we want to try and create environments for people where they can talk about this very difficult subject of losing people and all the impacts, not just the loss of that person and how you felt about them, but the practicalities of what does this mean for keeping a roof over our head and paying the bills. And if one person in the relationship managed all the finances and all those sorts of practicalities, and the person left behind doesn't know where anything is, doesn't know the passwords to accounts and things like that. It's also these real basic day-to-day things that get stirred into that pot of grief too. And so, these are some of the common losses that people are going to be experiencing during this pandemic. Of course, the loss of loved ones, whether they are close family members, friends, or colleagues, or or acquaintances, just people that in your community who live on the same street, that you may not have known them personally, but it still impacts us. A big one has been this need for us, the need for our own and other people's safety to be physically distanced from each other, to not be able to do that hugging and kissing or even shaking hands that we have always been used to in terms of keeping connected. Freedom of movement, routines, community contact, and of course, all those financial aspects, economic security, people losing jobs because businesses have had to close down as a result of the pandemic, and of course, access to medical supplies, equipment, hospital services has been, a major issue. I know in India, and of course, the fact that that services have been so overrun and it's not been equitable in terms of people's access to service is going to cause a great deal of distress and anger for parts of the population. And then, of course, there's loss of control as well, and some of that loss of control is is perceived because we do still have control over things, certain things that we do every day. But that whole thing of the lack of freedom of movement, the things that we just have always taken for granted that we could do, have been lost as a result of the pandemic. But there may also be losses that are lesser known or understood, and that people may not recognise are just as significant for those people experiencing the loss as losing someone as a consequence of COVID-19. And so this might be, and this is going to have happened to numerous people across the world, the death of a loved one that hasn't been related to COVID. The person has died from other causes, but the pandemic has impacted people's ability to be with their loved one towards or at the end of life, with restrictions to hospitals and those sorts of things, and also being impacted in terms of coming together for funerals and cremations and and other ways, rituals of marking the loss of someone's life. There will be separations and divorces going on that would have happened without the pandemic, but may also have been more likely brought on as stresses due to the pandemic. We certainly know there's been an increase of domestic abuse and coercive control during this time, more suicides, but there are also maybe issues for people around who were planning to have a child before the pandemic. And then as a result of the pandemic, you all know, we can't now go ahead with our plans for a family while this is going on, or people who perhaps were undergoing fertility treatments and and IVF, all this having to be put on hold as a result. The rituals and rites of passages that we talked about in part one with children, particularly those who their final year of school and doing their exams together and then going out and celebrating with their friends and and all those sorts of things. But also maybe weddings have been postponed and other important celebrations, worship events, gatherings are also significant losses that people have experienced. So for us not to just have in our mind that the only people or the most seriously impacted are those who've experienced the death of a loved one directly related to the virus, because all these other losses are as important and significant to the people who've experienced them. So this brings us to look at how do people, or some people, manage those overwhelming feelings of traumatic grief. And we talked about the problem is not the problem, but a solution to another problem in part one. And we looked at that in particularly in relation to things like using alcohol or drugs or self-harming behaviour as a way of pushing away or disconnecting from really difficult internal experiences. But the problem is not the problem. Finding other ways of expressing grief is also relevant here too. And we can find that very often traumatic grief is defended against with anger, with people becoming not just angry, but which is an emotion, but being aggressive, which is a behavior, being more impulsive, being overwhelmed by feelings of guilt or shame, or dissociation, just sort of people who literally sort of zone out. I cannot be here in this physical body, so I'm just going to sort of like disconnect and be outside of myself. So this might be in terms of experiencing derealization or depersonalization or other kinds of dissociative experiences. But what I would really like to focus on in a little bit more depth around these different ways that people might be defending or expressing their traumatic grief is to have a look at the role of shame. And the thing is that people can feel a great deal of shame around how they have lost a person, why they have lost a person, what they feel that they did do or didn't do, or they should have done or shouldn't have done. We're going to talk about this a little bit more with children in terms of the locus of control shift. But people can feel that there's something that was lacking in them, that there is something that they could or should have been able to do to prevent this person from dying, from losing this person, however that loss occurred. And so we can see shame and guilt being very closely connected in these scenarios. as being a way of defending against really, I guess, accepting and allowing all of the feelings of their loss to be experienced. And there are 4 different faces of shame that Donald Nathanson talks about in the shame compass. And the first form of shame is this one here. And this is probably the type of shame that, all of us would identify, oh, this person's sort of like feeling a bit ashamed because of their behavior. This is the person who withdraws. And so we'd see a lowering of the eyes, a looking away, maybe covering their face. We might see sort of like flushing. Withdrawal can be also actually withdrawing from people, and the withdrawing from people is because if I'm not around people, then my shame will not come up. So it's a way of not experiencing that shame. Another form of shame on the compass is this one here, attack self. And attack self describes the person who is constantly putting themselves down or undermining themselves. I'm such an idiot. I'm so stupid. Why did I do this? Or why didn't do that? I'm just an idiot. And there's interesting, there's a very well-known comedian here in Australia called Hannah Gatsby. And she several years ago made a documentary about her life and her career, where she talked about that she realized that her comedy was all based on putting herself down, of making fun of herself, of saying horrible, mean things, or making jokes about the way other people had humiliated her and made her feel ashamed. And she realized that that was not a healthy way of being, that it was really impacting her self-esteem and her mental health. Now, of course, it's important that we do have the capacity to laugh at ourselves and not to take ourselves so seriously all the time. That's that's healthy. But if we look at that behavior along a continuum, there's a point where that sort of laughing and joking ourselves actually becomes unhealthy, and it's really attacking ourselves. And of course, the other levels of extreme of attacking ourselves would be things like self-harming behavior as well. And then there is the person whose shame approach or shame defense is avoidance. And the avoidance, the shame response, is the person who is quite narcissistic and grandiose in their presentation. They really sort of inflate themselves, fluff themselves up, look at me, aren't I great? And if you've got a problem with this, what I've said, what I've done, well, that's your problem. It's not my problem. You deal with it. And that's a real way of deflecting feeling ashamed of themselves by saying, hey, this has nothing to do with me. You deal with it. And this kind of avoidance behavior can also escalate to being quite risk-taking behavior. It can be quite impulsive. So this might be the person who gets into very risky sports. And I'm not saying that everybody who does high-risk sports has an avoidance shame response by any means. But but we can see that kind of risk-taking, macho presentation, or being very seductive, presentation is a way of deflecting from, actually, I don't feel so good about myself. And then the final way on the shame compass is the attack other. And this is the person who becomes very verbally aggressive towards other people, and really kind of like that, you know, attack you, it's all your fault, in a different way of the avoidance person who's sort of like, well, you know, that's your problem, I don't care. The attack other, sort of like blaming the person, is it's your fault, you've done this to me, you're to blame, you've got to fix it. And of course that verbal and sort of like, you know, emotional or psychological aggression can escalate into, you know, physical aggression. And what we see is at that extreme is what's called humiliated fury. And humiliated fury is often what we're seeing in incidents of domestic violence, and when that escalates also into the murder of a partner, is the person feeling so out of control, so you know, overwhelmed with shame, that the only way that they can make themselves feel better is to control the other person and push them down and make them feel small. And so I'd like you to think about when you're working with your clients, or being just mindful of these different shame responses and how they can be interwoven with people's grief, traumatic grief, as a way of trying to stay away from the understandable. People want to stay away from those, you know, very painful, distressing feelings, but it doesn't help us in the long term to deflect and to be stuck in feeling ashamed of something that is not good shame, in the sense of when we do something that we know is wrong and we feel ashamed about it, and it's a message to ourselves, I'm not going to do that again because it makes me feel bad. And so just be mindful of those shame responses, so that you, if you get these types of behaviours or presentations with your clients, that you dig a little bit deeper underneath to see what might actually be going on there, rather than seeing the person, you know, or they're being a bit narcissistic or aggressive, but to really explore what might be sitting underneath or behind those presentations, so that we can actually deal with what the real problem is, rather than the way that the person is deflecting it. And then the final face of shame, which isn't part of Nathanson's shame compass, but we see a lot with people who are overwhelmed and traumatized, is sort of like dissociation, is really just sort of like not being present in some shape or form, as a way of staying away from very difficult feelings and emotions. And so this really leads us into looking at post-traumatic transference. And, you know, this is, you know, our clients' feelings or experiences of traumatic loss being perhaps perceived to be a betrayal, and a betrayal by government and institutions. If the government had done this or hadn't done that, then, you know, my husband, wife, child, mother, father, whoever would still be alive. And that sense of being betrayed by authority figures, by people who have greater control over our lives and the way that we live our lives, may be projected onto us as therapists. So we need to expect there might be a certain degree of anger or mistrust or unreasonable demands and expectations that the client projects onto us as therapists, to fix the problem for them, to make the pain go away, or to find the solution to their economic situation now, or to somehow fix it and rescue them from the situation that they are now in. And so again, I think, you know, we need to expect that, that this is grist for the mill, and not to misunderstand some of those projections onto us, taking them at face value, but to really sort of like be able to hold whatever may be being sort of like projected onto us or transferred onto us, without taking it on board, but saying, oh, okay, you know, there's a lot of anger and mistrust here, wondering where that's coming from, and to explore it further, rather than going into our counter-transference response and wanting to sort of like push back, you know, and we've all had those clients that for whatever reason push our buttons, you know, they know just the thing to say or do that will, you know, get a response. And of course, we do our best always to hold those counter-transference responses, because it's not a question that we should not have counter-transference. We're human beings, and the counter-transference that we experience tells us something about the nature of the relationship that we have with our client. It tells us something about our client's experience. It also tells us something about ourselves. So there's a lot of, you know, communication and information in those counter-transference responses. But we want to do our best to not act on those counter-transference responses, but to be, oh, I can feel myself having a, you know, a bit of a response to what the client has just said or done then. You know, I just need to perhaps calm myself down in the moment and just say, okay, I need to maybe think about that after the session, about what it was that came up for me when my client said or did whatever it might be. I need to take that to my supervisor and discuss that in supervision. But of course, as I mentioned right at the beginning of the training, this is not just a crisis that is happening to your clients. It's a crisis that is happening to you as well. Everybody's going through it in real time. And so your own anxieties, fears, losses due to the pandemic, and any other life situation that may be going on in your life are going to also be heightened as a result of the pandemic, and also because of those increased demands that clients may be putting onto you, having expectations that are not realistic and not, you know, and not reasonable. And so I think the other thing that it's important for us as therapists to be mindful is to not take on board the client's demands or expectations that may not be reasonable, things that we cannot do, that we cannot meet, but also not to have unrealistic expectations of ourselves, of, you know, what we think we should be doing to make things, you know, better for our clients, to fix it. And again, I think it's like in the normal course of events, most of us, most of the time, get this. We get the counter-transference piece, and that it's our stuff, and we need to, you know, not buy into what the client might be projecting onto us. But in situations of heightened stress and anxiety for ourselves, what we know may not always be so easily accessible. So just kind of grounding ourselves, you know, before our sessions with clients, focusing on calming ourselves down and opening ourselves up to our clients, but not too much, as we'll be talking about a bit more in a moment, will help us with those post-traumatic counter-transference responses when they come up. Because what we want to be really careful of is that we don't find ourselves stepping onto this triangle dynamic with our clients. And you've got a handout on Cartman's triangle, so I'm not going to go into a huge amount of depth about the triangle right now, because you can read about it some more after the training. But what I'd just like to briefly talk about with this dynamic is that it is a relational dynamic that anyone can find themselves on that triangle, on any point on the triangle, and at different points in our life. We all will. The issue is about recognizing the dynamic, and hopefully before we find ourselves on the point of the triangle, that we take a step back, or that if we do end up on the triangle, we recognize it really quickly and find a way to step off. So let's just quickly go over what this triangle dynamic is and how it can play out. So we're talking, remember, we're talking about clients' transference and our counter-transference here. And so the client coming to us and feeling victimized in some way, they have experienced some kind of loss, they're in a lot of distress, a lot of pain, understandably, and they may be looking to you to do something to fix a particular problem that they're experiencing, whether it's a practical one, I haven't got any money to pay the rent, or whether it's emotional, I'm so overwhelmed about the person that I've lost, I'm in such pain, please take the pain away from me. Whatever it might be, the client is feeling like a victim. And when we talk about the victim point on the triangle, in this dynamic, we're not talking about someone who has literally been victimized. We're not talking about someone who is, the victim of sexual abuse or domestic violence or, bullying or harassment at work. We're not talking about literal experiences of being victimized. We're talking about an internal perception of self, of being victim, of being a victim, of not being able to help oneself, of not being able to fix a problem, and someone else needs to rescue me from this situation. And so this is the projection that our clients have, that we should rescue them in some way. And of course, we can't rescue our clients. The best that we can do is to be alongside them as they work through whatever their particular issues might be, help them out, guide them, help contain them when they may need it, but we can't actually take the problem away from them. And so when we don't rescue the client, they may experience us as the persecutor, and this is where the demands may escalate. You're not helping me, you're a terrible therapist, you're making it worse, or you should do X, you should do Y, Y. So then the dynamic begins to change, is that the client has moved into the persecutor role, and we can end up feeling like the victim and that we have to defend ourselves. And we may try and defend ourselves by, oh, I've got to do more, I've got to meet those demands, and so go over time in sessions with our clients, or accept phone calls in the middle of the night, or do things beyond the role that we might ordinarily have to try and make things better. So we may be, put ourselves in the rescuer role, or if we get really sort of like defensive around it, we may push back, not in reasonable boundary setting ways, but by being angry with the client, about being, emotionally withdrawing, giving out the message, I'm not happy with you, this is not okay. And so the client feeling very sort of like insecure and vulnerable in the relationship. And so, of course, what we see when people get onto this triangle is that you bounce around from one point to the other. And so this is why we really need to be very mindful of our countertransference, because it's always the therapist's job to stay off the triangle. Doesn't matter what our clients say or do. I'm not saying it's okay to accept unreasonable behavior, but they're the client. Our job is to keep the relationship safe and contained. So if we find ourselves on the triangle at any point with our clients, it's our job to and responsibility to step back, have a look at what's going on, and really work with the client about what is happening there, and owning what we have done or not done that has contributed to the dynamic. So I would encourage you to have a look at that handout, and if you're not familiar with Cartman's triangle, to get really sort of like get your thoughts clear around it. And what's important here is to be really clear on your role and boundaries. Some of you might be in advocates' roles, because it might be your role to help people with accessing services or emergency finances or accommodation. That might be what your role is, in which case, then you take on those roles with your client. But if your role is as a therapist, then you need to be careful of stepping over those boundaries into doing things that are not your role, and that can cause greater stress on you and therefore the relationship. So be clear on your boundaries. Refer people for non-clinical assistances and resources. So yes, it might well be your role to have a list of shelters for domestic violence, for resources if people need financial assistance, or other types of assistance. Have that information on hand, but don't feel that it is your job to get those services up and running for your client. And to remember that you cannot fix it. There are no shortcuts. And of course, when clients present to us in highly distressed states, and particularly if we're feeling vulnerable for whatever is going on in our own lives, that urge to make it better, to fix it, or to push back on the client and to withdraw, can be heightened because of what's going on. So there are no shortcuts. And one of the most helpful things that you can say to your clients is to acknowledge their pain, their suffering and distress, and and let them know that I'm here. This will just take as long as it takes. It's okay to be feeling what you're feeling. It's understandable that you're feeling what you're feeling. What you're feeling is normal. It's part of the grieving process. To be alongside them, not to try and fix it or take it away. And this brings us to the 7 phases of grief, which is an adaptation of the work by Kubler-Ross. And this is what you'll be seeing is the shock and denial that people may be coming to you, a state of disbelief that I'm just overwhelmed, I don't know what to do, I can't think, I'm just feel numb, people just being in a very dysregulated state. We looked at in part 1 how you can support someone who's in a very dysregulated state. So we help them, regulate their states and recognize that it's going to be over a period of time that they are going to go through these different phases. And it's not as if there is a formula for this is what you do for this phase or that phase or the next phase. And the phase, of course, isn't linear. And this is why I've chosen this this strand of DNA, this spiral with the the world sitting in it, because to me it really symbolizes the whole idea of that the healing process, whatever that we're healing from, is like it's a spiral, that we go from over the same issue many, many times, and it can seem like we're just stuck in the one point, but that each time we return to that particular conversation, that particular issue, it's like it's at another level of the spiral and of the healing. So it sees that healing process as being, you know, like this, as opposed to, you know, like this. And the idea for me of that world sitting in the DNA strand is the idea that within all of us is the capacity to really heal from our wounds. Now, people can be very wounded, and they may have different capacities to access their inner resources, and those inner resources can be very depleted and diminished at different times, of course. But it's really about, I guess, more recognizing the agency and the integrity of the individual, and that our role is to help them go within to find what they need within themselves, hold them in that process, but not feel as though they are incapable of it. That people who are very distressed and overwhelmed and may need a lot of support for a period of time also do have capacities and resources. They may be quite small right now, but that's what we want to help them do, is to access what they do have available and build on it little bit by little bit by little bit, and to reassure them that this is really difficult, this is really tough. I know that you're hurting, I know that you're struggling. It's okay that you're doing that. I'm here. You know, you need to let yourself feel what you're feeling. And over time, it will be different lengths of time for people, different people, but they will find their way through these different steps. And I think, you know, one of the things too around depression is that that can be something that people feel very concerned about with a client who's very depressed, with a grieving situation, is that to understand that depression is actually part of it, and that the depression for many people can be part of the acceptance that this has happened. There's no more denying it, pushing it away, hoping that something will change and that I can get things back to the way they were. The depression is the almost like the surrender to, this is what it is, and you know, and now I need to find my way forward with what this new reality is. And that's when people begin to come out of the depression into the upward turn, where they can begin reconstructing, rebuilding their life, and find that there are things still in life for them to look forward to feel happy about, to you know, to experience joy again. But people just need to be allowed and accepted that these different stages will take however long, and they may go backwards and forwards, and they won't necessarily go things in a particular order. So not to be frightened of that yourselves when you're faced with clients who are really overwhelmed with grief, to just like, well, this is acceptable. I would expect you to be feeling this level of distress, because that can help take off some of the pressure that clients might be feeling. Oh, so I'm not going crazy. I thought I was going crazy. Other family members are telling me that I'm crazy, that I should have pulled myself together, but by now I should be back on my feet. And when we give people permission to experience what they're experiencing, as painful and as much as they might not want to, it's a relief. Like, I don't have to pretend that I'm feeling anything different. But for us, in this long-term journey with some of our clients, and with many people, you know, it's not as if you perhaps just sort of got, you know, one or two clients in your caseload at the moment who are going through these really difficult times. You are going to likely have majority of your caseloads in these kinds of situations. And so how do you actually take care of yourself? Now, we're going to look at that very briefly at the end of this training, but then the part 3 and 4 are specifically focused on self-care. But what I want to talk about right now, which is part of taking care of ourselves and our capacity to have you know, long careers in this work, is recognizing the difference between empathy and compassion, because they're words that we often use interchangeably as if they are the same thing. But actually, empathy and compassion are two different things. And what neurobiology of the brain, brain imaging shows, is that these two responses, empathy and compassion, are actually generated from different parts of the brain. So compassion comes from the medial orbital cortex and ventral striatum. Really important to remember those terms. Compassion comes with feelings of warmth and positive emotion towards another person. It's a feeling of concern for others' suffering with a motivation to help and assist in some way. And it's described as being with the person or alongside the person, as I've been talking about. Whereas empathy is about when we resonate with the suffering of another person. We're feeling that other person's pain because we're tapping into our own experience of a similar type of pain. It might not be the same experience, but we know that feeling of fear or anxiety or grief. And as the person is experiencing that feeling, we're tapping into our own feelings whilst we are with them. So we can imagine what that person is like, and we're blending with the person's suffering. And this engages a different part of the brain. It's the anterior insular and anterior mid-cingulate cortex. Don't get caught up on those names. I try not to either. But this is the part of the brain, or parts of the brain, that are areas that are associated with negative emotion. So feeling empathy for someone doesn't necessarily motivate us to help them. We may understand because we're resonating, we can identify with that pain, but it doesn't necessarily motivate us to help them. And the thing is that empathy is unsustainable. If every time we're with a client who is suffering, we're tapping into our own experiences of suffering, we are going to be depleted, burnt out, compassion fatigue very, very quickly. It's not sustainable. Whereas compassion is sustainable. You can be with someone with their suffering, but remain centered and connected to self. And of course, this reduces those experiences of counter-transference, because you're remaining centered and connected with yourself. Now, of course, we need both as therapists. We need to have empathy and we need to have compassion. But it's really important that when we're with clients who are telling their stories, that we watch where our mind goes, and whether our mind goes to, oh, that reminds me of losing my friend a couple of years ago, and then all my pain comes up, or it makes me think, what if this happened to someone I care about? What if this happens to me? That's going to take us down a very slippery slope into vicarious trauma, into having our own traumatic reactions. So we really want to be able to balance that empathy and compassion, and make sure that we are not being drawn into our own feeling responses too much. And if we recognize that in the moment, that we don't just build up a wall and, you know, distance ourselves from our clients, but it's kind of like, oh, I recognize I'm getting too drawn in to my client's reality right now. I need to just sit back and press my feet into the floor, focus on my breathing, reassure myself, and bring up the compassion. So I just want to talk about a couple of examples or scenarios that might happen, and how you might year-old son, because medical experts are forewarning of you know, a third wave that could be you know, affecting children. Now we know that there has been loss of life and infection with children, but it's been much less than adults. And of course now with strains as they are mutating, there is a concern that children will become, you know, more vulnerable. And so this woman who's really just lost her husband is now focused on being worried about her son. So what do we do there? I think, you know, there's a couple of things, and of course this is a very, you know, brief response that I'm suggesting here, but we've got two things going on here. We've got a woman who is grieving, and rather than perhaps her allowing herself to feel her grief about the loss of her husband, what is safer for her to do is to focus on worrying about her 15-year-old son. Understandable that she is. I'm not at all diminishing those, you know, those worries and concerns, but it could be an avoidance of her grief for her husband. And so you might talk to this woman about, you know, it's understandable that you're really worried, you know, about your son. Can you tell me, you know, what are you doing in your household in terms of health precautions? So help her go through the, you know, all the things that we know: hand washing, physical distancing, wearing masks, you know, all that kind of stuff. And, you know, and say to her, you know what, it sounds like to me that you and your son are doing all that you can to keep him safe. And this is just sort of, you know, a reminder to you to not be, you know, have your whole life sort of like being really hyper vigilant about everything, but just maintaining those simple routines and making sure that your son sort of understands it, you know, and that, you know, and that he's doing it. So you just go over those sorts of basic, you know, routines. This is all you can do in terms of, this is what you have control over. Remember, in part one, we looked at that circle of control over the things that we can influence and control and the things that we can't. Spend time focusing on what we can influence and control, not the things that we can't, that the virus might mutate and be more of a risk to children. Nothing that you can do about that. What you can do is look at your own safety precautions within your home. And once she's feeling clearer, more able to you know, to manage her anxiety around that, then maybe she can turn her attention onto the grief of losing her husband, and you can help her with that grief. With the other example, we've got a woman who is saying, you know, she just wishes she was dead. Her brother has died. She's very close to him, and, you know, like, life now is not worth living now. She's lost this person who she, you know, she loved and was very close to, and all those things that she used to enjoy just don't bring her any joy or satisfaction. She wants to just withdraw from people. She's irritated by people offering her condolences because she doesn't feel, you know, they're genuine. Again, it's like, we don't want to go in and say, you know, look, I'm sure they do mean it. I'm sure they only got your best interests at heart. How that would be received by the woman is, you don't get it. You're not with me. You don't know what I'm experiencing. So whilst it might be perfectly true that her families do care and are genuine, that's not the point here. The point here is that this woman is really sort of like suffering, and she's using her anger, she's using anger as a way of staying away from other feelings and emotions. And rather than saying, oh, well, you know, how would your brother feel if if you died? He wouldn't want you to be feeling like this. Again, it's sort of like missing the point. You want to align with the woman and say, it sounds to me that you and your brother were really, really close. Can you tell me something about him? Get her to talk about this person who she's loved so much and that who she's missing so much, that she's feeling that life isn't worth it anymore. Because by giving her the space to talk about the person that she loves, and will help her open up her feelings of grief and work with them and move through them and express them, rather than push them away with anger and irritation, or just sort of shutting down. You know, it's an understandable thing to feel that you don't want to go anymore when you've lost someone that you love. You know, many people can feel like that. You know, it's okay. Tell me about your brother. He sounds like he was a really lovely man. You're coming alongside her and acknowledging her pain and suffering. This is what we want to do, is to be where the person is at, not try and get them somewhere else where we think or other people think that they should be. And as we explore things, you know, with our clients, different things are going to work for different people. So it's a good idea to have, just an idea of different things that you can offer to your clients as a way of helping them to express their grief, to remember the person that they love, and to go through some of those rituals that they haven't been able to do because of physical distancing and not being able to have funerals and cremations and family gatherings, to look at other ways that they can safely connect with their feelings. So these are some of the things that you might suggest to clients that they might try, and that, you know, different things are going to resonate with different people, and different things, you know, at different times. So say, for example, the woman who had lost her brother, you know, you might say to him, you know, what was his favorite meal? And she tells you, what was his favorite meal. How about you cook that, and you just remember him while you're cooking it, and you sit and eat that meal. You could even serve a plate up for him, and just remember what it was like, and maybe set the table really beautifully and light some candles and whatever. Don't be frightened of helping clients do things that will remind them of the person, because I think very often people around the person who is grieving are frightened to use the person's name, or to talk about them. Now, in some cultures, that's actually culturally expected. So, for example, with First Nations people, when someone dies, their name can't be spoken for. There's no predetermined time. It could be weeks, it could be months, it could be years, and you can't show images of that person. So obviously all these things are very culturally, need to be understood culturally about what might be appropriate or not appropriate depending on a particular culture. But where it is appropriate, talk someone's name and to you know, to really honor them in some way. That can really help people feel supported. You know, whenever I try and talk about my brother, people just change the subject. You know, that might be those people trying to do the best they can, but it's not helping the person work through their grief. So let's move on now to talk about children for a little while, because of course, you know, children and adults in terms of how they grieve is going to look different. In the same way, in part one, we looked at how adults and children express fear and anxiety differently. Grief can look different in children too, and so we need to be able to, you know, identify signs of grief and distress in children who may not be able to articulate what it is that they're feeling, but also who may, because they've got grieving adults around them, perhaps feel that they can't talk about what they're feeling because mum or dad or, you know, grandmother or grandfather are really upset and distressed, so they have to sort of like hold it, you know, in themselves. And so we see these kinds of potential behaviours as signs that a child might be really distressed and grieving. And so if you're working with parents with you know, with adults who've got children and they're describing certain behaviours you know, in their children, and they don't know why they're doing them, and they may be trying to use discipline as a way of changing the child's behaviour, you might help them understand, you know, I'm wondering whether your son or your daughter is actually feeling a lot of grief and they don't know how to express that. And so it's coming out through not being able to concentrate on their schoolwork, or they're having, you know, trouble sleeping, or they're not eating, or they're being fussy about the food that you put in front of them. You know, I'm wondering if that's a way that they're trying to communicate that they're, you know, they're really struggling with some emotions inside. So, you know, like we talked about with adults, the problem is not the problem, but a solution to another problem. This is the children's version of that, of trying to find ways to express their distress when they don't have outlets or perhaps the supports to work through what they're feeling in other ways. And this brings us to having a look on exploring of the locus of control shift. And the locus of control is the sense that we have within us, whether we're children or adults, about how much control and influence we have over things that happen around us and to us. And when we talk about, and also it's that sense of knowing what we're responsible for and what we're not responsible for, that whole circle of influence, what we can control and what we can't control. When we're talking about the locus of control shift in children, we're talking about that children understanding and interpreting things that happen to them or around them that impact them and impact the people that they love and care about as being something to do with them. Children are very egocentric. That's the nature of being a child. If I'm a good little girl or boy, then good things will happen to me. If I'm a bad little girl or boy, then bad things will happen to me. That's how children make sense of the world. And so when we're talking about grief, the loss of someone close, a child might make sense of that person, you know, dying, no longer being there anymore, as something that they did or they didn't do. They might blame themselves. Oh, you know, I kissed my grandma, and you know that I wasn't meant to, but you know, I just ran up to her and I hugged her and kissed her, and now she's died. It's my fault. or you know, I touched that food, and you know, and mummy told me not to touch the food, but I did, and now you know my aunt is sick, or whatever it might be. But the child makes sense of events as somehow they are responsible for it. And how this, in a very sort of, you know, strange way, helps the child is that if they can blame themselves for what happened, it compensates for feelings of being helpless and powerless. It's that idea that if something has happened because I'm responsible for it, then I could have done something differently, and next time I can do it better so that something bad doesn't happen. So it's a misdirected attempt to try and manage their pain of the loss, their feelings of shame, their feelings of grief and anger. And of course, blaming themselves is an illusion of power. We talked about in part one how feelings of powerlessness, of being out of control, are, you know, some of the most difficult experiences for us as human beings to be able to tolerate. And so we're always looking for things that help us feel as though we've got power and control over what's happened. And so this is the way, you know, a child can express their feelings of helplessness and powerlessness, is to blame themselves. So we'll talk about how do you, you know, help children with that, you know, in a moment. But what we need to understand that for children is, you know, who are going through a lot of these very painful losses and ongoing stress, is that they are going to be, many of them, at a heightened risk of some longer term negative impacts, including mental health issues, maybe dropping out of schooling earlier, or less academic success, lower self-esteem, and also more sexual risk behaviours of, you know, when they reach adolescence. It's all a part of this trying to make sense and control things where they feel out of control, you know, the risk-taking behaviour. So we do need to take children's grieving, you know, very seriously. Obviously, we don't want to be panicking, and we don't want, you know, parents, we don't want to be increasing their sense of panic, but we do need to be very mindful that children are going to need support as well, not just their parents. And so we've got some scenarios here of a teen who has lost his father to COVID, and now is not interested in his studies. You know, it's like, what's the point? You know, type attitude. Now that can be a fairly typical teenage response for a lot of teenagers. It's like, oh, couldn't be bothered, too hard, don't care, not interested. And of course, you know, that's part of the whole, you know, a difficult adolescent struggle that you know, that kids often go through, but obviously going to be heightened in this sort of like pandemic situation where they're dealing with different losses. Before I talk about how we handle it, let's look at another scenario with siblings who've lost both parents to COVID, and they're being cared for by grandparents who are also grieving the loss of their son or their daughter. I mean, these are some very likely scenarios that clients, children that you are working with may be going through, or similar things. So what don't we want to say to kids, whatever age they are, whether they're young, whether they're teenagers? We don't want children to feel responsible for other siblings or, you know, another parent, and trying to control their behaviour or discipline them by saying, you know, you need to be sort of like tough, you need to be strong for your, you know, your little brother or your sister, they need you right now. So kind of putting them into a parenting role where they have to be responsible for someone who's younger than them. We don't want to be saying things, you know, playing into feelings of guilt and shame of, you know, your mother or your father will be so disappointed if they saw you behaving this way. Again, using shame and guilt as a way of trying to manage a child's behavior, and the behavior is actually trying to express in the best way that they can, I'm not okay, I'm in pain here, I'm needing some help, I'm needing some love. Just trying to discipline them out of that is not going to help. Or saying, okay, look, you know, it's enough now, you've got to do your schoolwork, you've got to get back to study, you've got exams coming up, you know, you must help around the house, you know, like pull your socks up, sort of like very British term, pull your socks up, and, you know, just sort of like get on with it. Or you're not the only one who misses your mum or your dad or your, you know, your grandmother, your grandfather, you know, other people are grieving too. Of course, other people are grieving too. And everybody's grief needs to be acknowledged and respected. And I think, you know, this is a really important one of children feeling as though that they have to be responsible for adults who are you know, who are suffering. And so really important that you talk to parents about not talking about their problems to their children. Parents can do this a lot when they're feeling overwhelmed, or you know, just put on responsibilities onto a child that are beyond their age and capacity. You know, those adults need to be finding other supports and helps, not looking to their children to take responsibility for things that are, you know, an adult's job. So what can you say to kids who are really suffering? Things like, you know, sometimes we feel it's our fault when someone dies, but, you know, really it's not. And, you know, then talk to them about COVID, to talk to them about how the virus works and how, you know, they're not responsible for, you know, what happened. And also just really acknowledging it's really hard to imagine that someone we love has died, that they're not here anymore, that we won't hug them, that we won't hear them laughing, that we won't be able to sing that favourite song with them. You know, acknowledging it, not being frightened to say what it is that the child is going to be thinking and feeling, but they not have the words to express. And acknowledging, I'm really sorry about your mum. I'm really sorry. I know that you miss them so much. I know that it's really hurting, and it's okay to talk about how you're feeling. You know, you don't have to keep it all, you know, locked up inside. Sometimes, you know, it really helps to have a good cry or to get angry and thump your pillow, get those feelings out. That's really okay to do, and, you know, and I'll help you with that. And if you don't want to talk right now, that's okay too. You know, I'm here anytime that you do want to talk to me. So, you know, it's whatever you need. You know, I'm here. Just, you know, just tell me, and you know, we'll work through this together. So these are some of the things it gives, giving children permission to feel what they feel, to think what they're thinking, to do or say or not do or say things in their own time, rather than parents feeling as though they have to rush them through the grieving process and get them back to school, get them back on track. I mean, I think that part of it is recognizing that it's understandable that kids schooling is going to fall behind. I mean, it's you know, it's been really challenging for children who've been homeschooling for you know, for a very long time now. It's impacting kids' education, but if parents are too worried and too focused on that, they are going to inhibit the child's capacity to actually process through their grief, their loss, at many different levels of the losses that they're going through, and for them to understand that academic results are not always or ever necessarily the most important thing. It's about children growing up mentally, emotionally healthy and functioning, and developing resources that will carry them through their lives. And that schooling can be attended to down the track if a child has the real opportunity to process through what they need to. They will get back to their study, but focusing on the study as being the priority will just sort of like delay anything, create power struggles, and make the study more of an issue and suffer more. So you can ask children, can you draw something about how you feel? Something is a container, so it doesn't feel overwhelming. I have to draw these huge, big, exploding feelings inside, but I'll draw something about how I'm feeling. If you remember back to part one, I talked about my nieces, my daughter, my great niece, using toys. Can you show me with the toys how you're feeling? Or externalizing. I wonder how Dolly's feeling right now. I wonder how the dog or cat might be feeling. Shall we find out? Let's ask them. Have imaginary conversations with the toys or with the pet cat or dog. Older children, you can suggest to them writing down their thoughts. Or to some older children might be, with encouragement, more able to articulate what they're feeling. But kids need space and opportunity to express what's going on for them on a regular basis. So keeping on checking in them, and that will assist them to process grief in their own way, in their own time. And if it's being paid attention to consistently, it will reduce the potential for sudden explosions and power struggles with parents or other family members too. And I want to just go through now some examples of client artwork around grief, anger, and other emotions, just to sort of encourage your clients to draw whatever it is, and this is for adults as well, not just children, to draw that will show something about how they're feeling. They don't have to be great artists or anything. It's just about putting crayons or paints to paper and letting them show whatever it is that's inside, and then just inviting them, can you tell me something about what you've drawn? So we're not trying to interpret it, but we are asking them to, or inviting them to tell us something about what the drawing is expressing. Other activities that you might do with children is making a beaded memory bracelet, or creating the family recipe book like we talked about with the woman and her brother cooking his favorite meal, collecting things that remind you of that person, writing about a favorite memory they have of that person, or writing a poem or a letter to the person that they've lost, and inviting them to read it out loud, because the reading it out loud might help them to connect and express with their emotions, rather than just writing it out and you reading it yourself. Ask them, would you like to read that out to me? So let's just move on a little bit now and to talk about groups. Now, of course, groups can be a fabulous way of people finding support with people who've been through very similar things to them, to themselves. And so, to think about running groups, but I think that there are certain things that are important to consider when you're running a group. So we can't go into details about how you set up a group, run it, and all those sorts of things, because that was, that's a whole other, training in of itself. But there are some things that I would suggest that you consider if you are thinking about running groups. First of all, groups can be absolutely fabulous. But there are things that we should really take into consideration and think about before we get a group up and running. Are you going to have one or two facilitators? If you are new to running groups, I would definitely suggest having 2 people on board, because it just helps with running the group dynamic and contain, and it means that you've got someone else backing you up if things perhaps get a bit difficult in the managing the group. You want to think about the number of participants that you have. You want it to be sort of like big enough that you've got people who can interact, and there are lots of different ideas that are bounced back and forwards, but you don't want it to be so big that people who are perhaps shyer or more reserved around talking in group situations feel that they are too uncomfortable to speak in a large group. So, you might want to think about numbers, say from 5, maybe 10 maximum for your group. Think about whether you're going to have a fixed number of sessions or it's an open-ended group that will just run indefinitely. Do you want to set themes for the group? Like each week you will have a particular theme that the group will explore together, or is it a group with no agenda that anybody can sort of like bring in whatever they want to? I think that sometimes having more of a structure for the group, particularly in the early group meetings, can be good, because then it gives people something that they can really get their their thoughts and heads around, and they can focus on, rather than having to come up with some ideas or thoughts that they may feel I'm not sure if that's right or if it's okay. So I think themes for groups can be really helpful. You might want to talk about, about having sort of like rules in place for the group about what we are going to talk about, what we're not going to talk about. For example, I would really advise against scenarios where group members talk in details about distressing ends of loved ones' lives, going through all that, what happened, physically and things. It's not really helpful for that. That's something to share in a one-on-one situation. So you want to talk about more broader things around how people are feeling and coping and what helps and isn't helping, rather than the details of how someone was lost. You might want to think about confidentiality agreements with the group. What we talk about in group just gets stayed in group. You don't talk about it with people outside the group. You might want to talk about informed consent. The pros and cons of joining a group. Some people might find it really helps them. Other people might find that sometimes after the group they feel worse. So giving people information about what they might expect the benefits or some of the downsides might be. And also to think, how will you manage a situation if someone becomes really overwhelmed during a group scenario? And this is where having a second facilitator can be really helpful. Whether you're doing your group on an online platform, you can have a breakout room where the facilitator and the distressed person go to speak, and the rest of the group can keep going while they're having their private discussion, and then either come back to the group or not, as the person feels. So have a think about these things if you're thinking about running groups. And if you're thinking about running groups for children, these are the kind of age ranges that you would think about putting kids together. And I'm sure there are people listening to this training who already got a lot of experience of running groups with children. In terms of activities and rituals, it's the same, really, the same kinds of things for you know, for children and adults that you can do, whether it's done in groups or whether it's done individually. So, I mean, obviously, in terms of the movement stuff, you know, running, cycling, and swimming, that's individual activity. It's not, you know, sort of group activity, but group activities could be online yoga or online dancing or some kind of movement to express things. And you could have craft work, either people sitting, knitting, crocheting, or drawing during the group. I mean, you know, I think if one thing this pandemic has certainly showed is like how much we can do online that we didn't think would be possible too. Writing poems and reading them out, sharing them as a group. So really, there's, you know, there's so many different things that you can do. It's really, you know, your imagination, and also the members of your group imagination, getting ideas from people so that they, you know, they take some ownership of the activities that occur in the group as well. And of course, doing some mindfulness meditations. And we're going to be closing this training with a mindfulness meditation too. Can also be a really helpful thing. You might want to start the group or close the group with a meditation, or both, opening and closing. And I think that really very briefly, before we, you know, move to closing this particular training down, it's also for you to think about, you know, what's going to work for whom. And that even though you might have people coming to you in a very distressed state initially, as I mentioned earlier on, it's also important to remember that people have internal resources and capacities, and, you know, some people won't have a lot of external supports, absolutely, but there will be people that do. And so not everyone who has had a loss and who may be very, you know, distressed in the immediate aftermath of that loss is going to need in-depth sort of like clinical support, but they may respond very well to you know, suggestions of other support groups and services and resources that may be able to help them in different ways. And so some people will benefit from psychological first aid, and where that is the case, you know, we'd be asking you to think about where you can refer people to get some of the resources that might benefit, that they might benefit from. And this diagram here just sort of like looks at the overall sort of like a psychosocial mental health response in a sort of like a trauma situation, and to see where psychological first aid sits, it's below clinical services. So when you first come into contact with people, you might have a couple of sessions with them and think, you know, I think this person would actually really benefit from tapping into this particular group or resource, and, you know, and maybe they don't need your more in-depth, longer term work. And so in your handout, there's a resource slide at the end where, with a link where you can actually download the UN's psychological first aid resource, their guidebook, to have a look at that and to think about different clients that you have, and maybe where this could be an appropriate response for some of the people that you are seeing. And, you know, just as a sort of a final reminder about what the healing journey looks like, I don't know whether you have the kids board game in India, Snakes and Ladders, but it's a board game where you throw the dice and move across the board, and if you get on a ladder, you go up a few squares, and if you land on a snake, you know, you go back a few squares too. And this is really what the healing journey is like, that people will take step forwards, they will fall back, That's normal to be expected. And if we tell people this from the outset, you know, there'll be days where you feel, I'm really feeling a lot better. And then the next day you'll feel like you're right back in that hole again. If we let people know that, when it happens, they won't get so panicked about it. It's like, oh, yeah, my therapist said that this would probably happen, and they will understand it. And so seeing, this is a bit like the DNA strand that we looked at earlier. This is about maybe sort of like seeing that your clients, if we see this spiral as being your client, and these people on this spiral, different parts of your client's healing journey, that they're going to be at different stages of healing with different aspects of the journey. So some things they might be processing, you know, really quite well, and some other things they might be way back here and not really even started. And that's also normal, not to expect ourselves or our clients to be at the same level with everything in terms of working through a particular crisis or trauma. And it's really understanding that both at an individual level and at a national level, recovery is going to be a slow train. And that at this moment now, you're right in the middle of the eye of the storm. And once things slow down and the storm passes, this is when people at an individual level and also at a national level will begin the next level or layer of the healing journey. So please don't put pressure on yourselves. And when your clients put pressure on themselves, like I should be through this now, I should be feeling better, is to just pull it back and say, like, you know, you're doing fine. This is really, really tough. Don't expect so much of yourself. Try not to be hard on yourself. And finally, it's about recognizing that what our role is creating safe places, sharing where the unspeakable can be given voice, where feelings can be felt, and where sense can be made out of what seemed previously senseless. Taking care of yourselves, this is going to be the focus of parts 3 and 4, and to really understand that taking care of yourself has to be a priority, not only during this pandemic, but all your whole careers, taking care of yourself. And that means doing our own work, our inner work, our own healing, so that we are all the time paying attention to things that we need to. And this is an acronym that I came up with around self-care. It's about breathing, focusing on our breath, reaching out to other people, making connections, eating well, accepting we're not perfect. Hey, who knew it? No, we all stuff up. We want to learn from our mistakes, but not to expect ourselves not to make mistakes. Take time out for ourselves, so important. To really work on getting, you know, good night's sleep and practicing sleep hygiene, and to be exercising as well. We'll go through these things in more depth in the next training, but focusing on your breath. And this brings us to our closing meditation. So before we say goodbye today, if you feel comfortable, wherever you are, to just close your eyes. If you prefer to keep them open, that's okay too, but maybe just let your eyes drop down into your lap. Uncross your legs and keep your feet flat on the floor, and your hands just gently resting on your lap. And just gently now focus on your breathing. breathing normally in and out, letting your breath come and go, letting your breath find its natural rhythm. That's good. Now we're going to take a few slow, deep breaths. I'm going to count them in and out to a count of 3. So breathing in, 1, 2, 3, and out, 1, 2, 3. That's good. Breathing in, 1, 2, 3, out, 1, 2, 3. One more, breathing in, 1, 2, 3, and out, 1, 2, 3. That's good. And now let your breath return to its normal rhythm. Just breathing in and out. And as you follow your breath in, just allowing whatever comes to mind to be there. Noticing what comes in. Noticing what happens to your body as this thought comes in. And noticing, is there any feeling attached to this thought? And if a distressing thought comes in, or an image, or a feeling, don't fight it. Just let it come. Notice the changes that you feel with this thought, feeling, or image. Explore it, and now let it go. You are not your thoughts. You're not your bodily sensations or your feelings. You're something more than that. Now gently come back to focusing on your breath. That's good. Notice how you're breathing slowly and easily as thoughts come and go. Just noticing how this feels. And continue for a few moments in silence, just focusing on your breathing. In a moment, you'll hear the sound of a cymbal, and when you do, just gently move your fingers, wiggle your toes. You may want to stretch your arms, and then slowly open your eyes and bring yourself back into the room when you feel ready. Thank you for joining me. I know it's been a really difficult subject, and I hope that you just give yourself some time after this training to process through what we've talked about and to pay attention to yourselves, do something nice and gentle for yourself. And I look forward to seeing you all next time. Until then, stay safe.